Right after delivery, your temperature and blood pressure will be taken until they are stable. A nurse will observe you as you rest. You may have afterbirth pains, which are cramps caused by your uterus shrinking. Sanitary pads are used to absorb the discharge of the uterine lining. To ensure that you aren't bleeding too much, the pad will be checked, as well as the firmness of your uterus. To do this, a nurse will gently push down on your abdomen. If you have had anesthesia, you will be watched closely until you can feel and move your lower extremities. If you have perineal pain, an ice pack can help. You may have received stitches in the skin near your vagina to close a vaginal laceration or episiotomy. Your stitches should dissolve within weeks. Until then, you can help reduce the discomfort and aid in healing by keeping the area clean. Gently wipe from front to back after using the bathroom. After wiping, spray warm water on the area with a peri bottle or in the shower. You can also have a sitz bath, which means sitting in a tub with a few inches of water in it, then patting the area dry. Do not use soap or any solution except water on the area. You may shower. Change sanitary pads every 2 to 4 hours. Place cold or heat packs on the area as directed by your doctor or nurses. Sit on firm seats to avoid pulling on the stitches. Vaginal bleeding is normal after a delivery. The bleeding may be heavy at first, but should decrease over time. The color will change from bright red to brown pink and then to clear. Passing clots is normal as long as they are not frequent, smaller than a quarter in size, and not accompanied by heavy bleeding and cramping. This bleeding may last up to 6 weeks. Call your healthcare provider for heavy vaginal bleeding, unusual pain, foul odor, saturating more than 1 pad in an hour, or clots that are larger than the size of a $50. It will take 6 weeks for your cervix to completely heal. Nothing goes in the vagina for 6 weeks, which means no sex, douching, or tampons. Avoid tub baths for 2 weeks after delivery or until you can get in and out of the tub safely. Avoid swimming pools, spas, or lakes until after your first postpartum visit. Remember to empty your bladder at least every 3 to 4 hours to prevent a bladder infection. If you notice pain, burning, or urine that has a foul smell, call your healthcare provider. Drink plenty of fluids and eat foods high in fiber, such as fruits and vegetables, to get back to your normal bowel pattern. Use witch hazel pads, such as tucks, to help with hemorrhoids and avoid straining while having a bowel movement. Prune juice, stool softeners, and mild laxatives may help with constipation. Maintain a healthy diet will help the body repair itself after delivery. Avoid or limit processed foods, fast foods, and sugar. Drink plenty of fluids, especially water. New moms often experience night sweats, where extra water from pregnancy is eliminated. Kegels and squats will help regain perineal muscle tone. Walking is one of the best exercises you can do. Start with short distances and increase as you feel stronger. Heavy exercise should be postponed until your 6-week postpartum visit. If you are breastfeeding, it is not necessary to use soap on your nipples. Expressing milk and leaving it on your nipples will help protect them. Keep the breast area dry and change nursing pads when they become wet. Mothers who choose not to breastfeed need to continue to wear a supportive bra. Typically, a sports bra works well. Avoid breast stimulation. If engorgement occurs when the milk comes in for non-breastfeeding mothers, then cabbage leaves between your breast and bra can be used to dry up your milk. Change the leaves when they wilt. Chewing on peppermints may help dry up your milk as well. Please refer to your breastfeeding or formula feeding booklet as a reference for regarding newborn feeding. If you have any questions or concerns, call the Lactation Helpline at 803-434-6541. You may also make outpatient lactation appointments to get one-on-one help with your lactation after discharge. Hormonal shifts that cause mood swings are normal after your baby is born. Mixed feelings of sadness, anxiety, and fatigue are normal. This includes the tendency to cry. With rest, proper diet, and family support, this usually goes away within 2 weeks. 10% of women develop postpartum depression. If you do not feel better, please seek help. This does require treatment and/or counseling for recovery. Signs of postpartum depression include anxiousness, sadness, being unsure about taking care of your baby, and the inability to do chores and everyday things. You may call our support group at 803-296-3715. Light housework may be done after 1 week, and you may drive after 2 weeks if you are not on heavy pain medications and have little or no pain. Lift nothing heavier than your baby for 6 weeks. Call your doctor if you have chills or a fever greater than 100.4 degrees, painful or burning urination, heavy vaginal bleeding, and passing large clots, red and hardened breast, inability to keep down food or fluids, with uncontrollable nausea and vomiting. Call if your pain is not relieved by pain medication, including an unrelieved headache, shortness of breath, and chest pain, leg or calf swelling. Call if you have feelings of being out of control or thoughts of harming yourself or your baby.